a few years ago when I started working on a family genealogy project, and it was for my father's 80th birthday. So I went back through the generations, and I pretty quickly realized that for so many women, I knew really nothing about them. I mean, their stories were just lost to history. Usually what I could find out was the date of their birth, the date of their marriage, and the date of their death. And often the date of their death coincided with the birth of a child. It was a real shock. It really drove the point home to me that women's lives were forever transformed when we figured out how to make childbirth safer. I'm Diane, and I'm working on improving maternal and infant mortality in Senegal. The World Health Organization recommends that women get, at a minimum, 4 prenatal visits. And in this region of Senegal, women are getting maybe 1, and that first one often isn't until they're 7 months pregnant. In many parts of the world, when women became pregnant, they would write their will immediately because they knew how really dangerous childbirth was and that there was unfortunately, such a strong possibility that they wouldn't survive it. In the modern age, maternal care has advanced to the point where in developed countries, the percentage of women's deaths that are caused by complications from childbirth and pregnancy is 1%. In fact, it's far less than 1%. In Senegal, it's 21%. That kind of gap is just unacceptable. We know how to fix that. For a lot of women in these very rural districts, they might not get to health care because they've got several other children to care for, elderly family members, or the transportation is difficult or expensive. So the part that I'm really excited about in this project is that we're going to bring mobile clinics staffed by midwives to the markets, to the local markets, so that we bring health care to women. If they can't get to health care, we're going to bring it to them. And we're going to integrate into women's weekly routines. We're going to integrate into the rhythm of the region. And we're going to be able to see more women more often. Every expectant mother deserves a safe, healthy environment with a skilled provider to give birth.